planning for peripheral intervention. Okay. Honorable guest and respected teachers, residents, Assalamu alaikum. I am Dr. AKM Ziaul Huque, Assistant Professor, Vascular Surgery Department, Ibn Sina Medical College. Welcome to the session 30, Endovascular Intervention, step by step, in collaboration with Ibn Sina Vascular Surgery. And my topic is device planning for peripheral intervention. I would like to thank my previous presenters to discuss about the early topics, and it was actually very informative, and this was very necessary. As Professor Treja sir said, that puncture is very important, and also hardware selection and crossing the lesions, because these are the very vital parts for endovascular therapy. Now it comes after crossing the lesion, it comes about choice of device selection and device planning. There are lots of peripheral devices for peripheral intervention, but for today's session, I will discuss only stents and balloons. So why device planning is important? Because achieving optimum. Sorry.
So it is not moving. Oh, technical problem.
No, it's a technical problem. Occlusion, sir. There is no device planning, sir. Thank you very much. Okay, this is all about planning. So device planning is important for achieving optimum procedural outcome to minimize expenditure and minimize complication risks and enhance patient safety and comfort. So here comes patient assessment, including site of lesion assessment of the patient, and evaluation of peripheral pulses to select vascular access site, and to definitely evaluate imaging, especially duplex study to see atherosclerosis, stents, and PSB. We regularly evaluate the peak systolic velocity before going to endovascular procedures, and also we evaluate CT angiogram, MR angiogram, and peripheral angiograms to decide our planning. So device selection criteria includes lesion characteristics, vessel size, and its tortuosity, device compatibility with anatomic features. Now stents. So you all know that stents are tubular metal meshes that maintain the patency of the vascular lumen when it placed in a stenosis, and it comes a regular use from 1990. A British dentist, Charles R. Stent, it was named after him, the stents, and he is Sir's daughter who first performed PTA in 1964. There are various types of stents, including bare metal stents and covered stents. These are the pictures of covered and bare metal stents. Bare metal stents can be balloon expandable and self-expanding. So bare metal stents are composed of various materials, including stainless steel, nitinol, cobalt, chromium, etc. And covered stents adds PTA feed, Dacron, etc. So stents have various characteristics, and we all need to know these things before selecting a device, like flexibility, radial strength, keying resistance, biocompatibility, patency of the stents. So this depends on the material and design of the stent. And here you see two pictures, that is balloon expandable stents and self-expanding stents. Here there is a built-in balloon within the stent in case of balloon expandable stents, and there is no balloon in case of self-expanding stents, and we can dilate it if necessary using a balloon separately. So what are the advantages of balloon expandable stents? That it can be placed with great precision, অর্থাৎ যেখানে আমাদের খুব একদম অস্টিয়াল লেশন এবং জায়গা মতোই বসানো দরকার, সেই জায়গাটায় কিন্তু আমরা গ্রেটার প্রেসিশন দিয়ে খুব সিলেক্টিভ বেলুন এক্সপ্যান্ডেবল স্টেন্টের এটা সবচেয়ে বড় সুবিধা, যে আপনি ঠিক যে জায়গাটা চাচ্ছেন সেখানে আপনি বসাতে পারছেন। And disadvantages are it can be shortened when it is expanded, and when there is a tortuosity in the vessels, it cannot adapt with the tortuosity. And here is a picture of balloon expandable stents. So common sites for use of balloon expandable stents are brachiocephalic trunk, subclavian artery, renal artery, mesenteric artery, celiac trunk, and common iliac artery. and it is actually contraindicated. We don't use balloon expandable stents for vessels where there is external compression is present, and including internal carotid artery and SFA, superficial femoral artery. So this is a picture of placing a balloon expandable stents. You can see that that a stent does not uniformly cover the vascular wall, must be further expanded by a larger balloon that I was telling before. And these are some specifications, including that balloon expandable stents are supplied in the length of 12 to 57 millimeter, and ready to use stents mounted on balloons are available for vessel diameter of 2 to 10 millimeter. Now comes about self-expanding stents, and the common sites for self-stents are external iliac artery, SFA, popliteal artery, internal carotid artery, and subclavian artery if there is a long lesion. So this is a wall stent, and this is the epic vascular self-expanding stent system, and we are accustomed to this device. And it can be the design can be open cell design and closed cell design, and it's had own merits and demerits. Like stents with open cell have advantage of flexibility, and stents with closed cell have less flexibility, and it is very stable. So these are the pictures of open cell and closed cell self-expandable stents. So we have said earlier that self-expanding stents are made of mostly nitinol, that is alloy of nickel and titanium. And if you can see here that deploying a self-expanding stent, that inner catheter must not be moved, অর্থাৎ inner catheterটাকে আমরা ফিক্স করে ধরে রাখবো, এটা নড়াচড়া করবে না, বাট আউটার ক্যাথেটার যেটা আছে সেটাকে কিন্তু আমরা গ্র্যাজুয়ালি বাইরের দিকে নিয়ে আসি, এটাকে মোবিলাইজ করা হয়। এভাবে অ্যাকচুয়ালি আমাদের self-expanding স্টেন্টগুলো বসানো হয়। So these are some characteristics regarding self-expanding stents, including memory effect. যেহেতু এখানে কোনো বেলুন ব্যবহার করা হয় না, সেলফ এক্সপ্যান্ডিং স্টেন্টটাকে যখন বসানো হয়, এটি বডি টেম্পারেচার, এটাকে এমনভাবে ডিজাইন করা হয়, প্রোগ্রামিংটাই এমনভাবে করা যে আপনি যখন এটাকে ডেপ্লয় করবেন স্টেন্টটাকে প্রপার প্লেসে, তো এটি বডির টেম্পারেচার থেকে তার মেমোরি ইফেক্টে সে নিজেই বসে যাবে। যদিও আমরা কখনো বেলুন দিয়ে থাকি, কিন্তু এটা নিজেই বসে যেতে পারে। এটাকেই বলা হচ্ছে মেমোরি ইফেক্ট। ইট ইজ ওয়ান অফ দ্য মোস্ট ইম্পর্টেন্ট ক্যারেক্টারিস্টিক্স অফ সেলফ এক্সপ্যান্ডিং স্টেন্টস। And there are other some it is suitable for tortuous artery, and it is also fracture resistant. These are some pros and cons and regarding in different stents. So now comes a covered stent, and we use covered stent for sealing aneurysm, especially rupture of blood vessels, pseudoaneurysm, and traumatic AV fistulas. And this is the picture of Bhayaban VAVX balloon, and you see that this is a picture of treating pseudoaneurysm. And then our next device is balloon, and we use for balloon angioplasty. It is actually used for controlled dissection of arteriola. আমার সময় অ্যাক্সিডেন্ট হয়, দুর্ঘটনা ঘটে, আমরা ডিসেকশন করে ফেলি, বাট বেলুন এনজিওপ্লাস্টি হচ্ছে প্ল্যান্ড। আমরা প্ল্যান করি যে কতটুকু আমরা ডিসেকশন করতে চাই, সেইভাবে মেজারমেন্ট নিয়েই এটা কন্ট্রোল ডিসেকশন করা হয় আর্টেরিয়াল ওয়ালে। There are different types of balloon, like compliant balloons, semi-compliant, non-compliant balloons. We vascular surgeons mostly use non-compliant balloons in our regular practice. And there are some catheter types like over-the-wire system, rapid exchange system. We vascular surgeons use mostly over-the-wire system for our balloon angioplasty. This is a device, monorail catheter or rapid exchange, and over-the-wire balloon system. So those who work in cath lab, we know these two terms, that is nominal pressure and rated burst pressure. সংক্ষেপে যদি আমি বলি, নোমিনাল প্রেশার হচ্ছে এমন একটা প্রেশার যেটা দিয়ে তার মোস্ট ডিজায়ার্ড এক্সটেন্ট ডাইমেনশনে পৌঁছে যাবে, এটা হচ্ছে নোমিনাল প্রেশার। আর রেটেড বার্স্ট প্রেশার হচ্ছে এমন একটা প্রেশার যে প্রেশারে গেলে বেলুনটা ফেটে যেতে পারে, 1% চান্স আছে ফেটে যেতে পারে, অথবা এর বেশি যদি প্রেশারে নিয়ে যায় তাহলে এটা আরও সম্ভাবনা থাকে। So balloon indications for balloon angioplasty, it is for balloon knee disease and superficial femoral lesions. And this is the picture of compliant and non-compliant balloons. You can see here that non-compliant balloons dilated uniformly throughout the lesion, and it pushes atherosclerotic plates to the arterial wall. There are lots of balloons, and this is the snare system. এটা আমাদের বিপদের বন্ধু, এটা আমরা অনেকেই জানি. It is also another device, and we use a Pro Glide for as vascular closing device. So what are the take-home messages? Device planning varies according to site and nature of lesion. Stents of different sizes should be available in cath lab, and for any complications, rescue devices including covered stent and snare should be available in the cath lab. Thanks a lot for patient sharing. I would like to ask questions from the audiences.
There is another